How's it going, guys? Medium difficulty question, Cardiopulm, oncology, farm, steps 1 and 2. 45-year-old woman. She was on the ABVD regimen for Hodgkin lymphoma, doxorubicin, also known as adriamycin. Bleomycin, vincristine, dacarbazine, ended 6 months ago. You don't have to memorize ABVD regimen for Hodgkin. It's the fact that we listed the drugs and you should know some basic pharmacology surrounding these agents. Now, the chest x-ray has shown it's a massively dilated cardiac silhouette. This is pass level. Even if you say, I suck at radiology, don't know what I'm looking at, that's fine. Just cardiac silhouette is massively enlarged here. So that should stand out to you. And then we say there's no jugular venous distension or peripheral edema. That means we have no overt right heart decompensation where even if you look at the x-ray and you say, but wouldn't the right heart be involved if we have what looks like a congestive heart failure or dilated cardiomyopathy here? I agree with you, but maybe the patient is subclinical at the moment for the right heart failure findings, and maybe in a couple months we'll have JVD and peripheral edema. The point is, it assists in answering this question because we can eliminate some answer choices that involve absolute right heart decompensation. In contrast, the left heart is decompensated because we have increased pulmonary capillary wedge pressure. This equals left atrial pressure. So it's exceedingly high yield. You know for USMLE that if PCWB is high, we have left heart pathology. We make note that the dad died of COPD at 55. So what could have prevented these patients' findings? Let's just hop through. Choice A, early cessation, bleomycin, no change in daily dosage. Wrong fucking answer. Bleomycin causes pulmonary fibrosis. It causes the formation of free radicals. So basic pharmacology, I don't really know what to tell you. They could tell you honeycombing, reticular pattern, reticular nodular pattern on a chest x-ray CT. And if we had pulmonary fibrosis due to bleomycin, that would absolutely lead to right heart decompensation. That's called cor pulmonale, when you have right heart failure due to a pulmonary cause. Now, the PCWP would be normal in the setting of pulmonary fibrosis due to a drug because the left heart's not involved. The left heart comes after the lungs. So if your lungs are fucked up from fibrosis, from bleomycin, let's say, your PCWP, why would that be elevated? Your left heart's not going to be affected. It would all back up to the right heart. So you can eliminate, even if you don't know the hyper pedantic details surrounding OMG. Could it be choice A or choice C? If you're vacillating, dancing around bleomycin, doesn't fucking matter because your PCWP wouldn't be elevated. Okay, so I just threw A and C in here to be flagrant asshole. Okay, some of you get mixed up, confused. Wrong fucking answer. Choice B, early substitution of carbazine for busulfan. Wrong fucking answer. Okay, decarbazine's an alkylating agent, non-existent for USMLE. It just causes myelosuppression. Busulfan is a drug that can cause pulmonary fibrosis as well. I don't really know what to tell you. There's some drugs, amiodarone, busulfan, bleomycin, methotrexate. I'd say methotrexate. I've talked about that one many times in clips, causing pulmonary fibrosis. Methotrexate's the highest yield one for you. I'd say methotrexate followed by bleomycin are the two main drugs you should know cause pulmonary fibrosis. Okay, busulfan can do it as well. Nitrofurantoin can technically do it. Okay, but wrong fucking answer. Choice C, as I already discussed, with choice A, wrong fucking answer, because you'd have a normal PCWP, and this isn't pulmonary fibrosis. Wrong fucking answer. Choice D, reduced duration of adriamycin with maintenance of dosage. Correct answer. So adriamycin, doxorubicin can cause dilated cardiomyopathy. Basic pharmacology. Some of you say, well, this wasn't hard. This is pass level. It's not medium difficulty. That's fine. Some of you didn't know that. So we're talking about difficulty in relation to the fraction of students that are learning this for the first time. So your take-home point is that doxorubicin or danorubicin, hydroxydanorubicin, there's variations, but the rubicins can cause dilated cardiomyopathy, whereas bleomycin causes pulmonary fibrosis. Okay, cool. You know that distinction now, and that's what we have here, dilated cardiomyopathy. So you just say it's the adriamycin, not crazy. And then I threw in choice E just to be trolling because, okay, dad died of alcoholic cirrhosis. The fuck am I saying? Dad died of COPD at 55. If they want alpha-1 antitrypsin deficiency, they can say, like, dad died of COPD, alcoholic cirrhosis, and brother has emphysema. This isn't emphysema, okay? So you'd have large black lungs, hyperinflated with all the air trapping, pushing the diaphragm down. Rather than a dilated cardiac silhouette, you'd have what's called a long, narrow cardiac silhouette, a vertical heart, where the massive lungs push the heart to the midline. You wouldn't even see a heart, basically. It would just look like kind of a straight line. Okay, I've made other clips on that as well. But alpha-1 antitrypsin breaks down elastase. Elastase is produced by the liver, goes to the lungs, but it can cause cirrhosis if you have a buildup of elastase, and emphysema, panacinal emphysema, if it's a buildup in the lungs. So alpha-1 antitrypsin, they want you to know for USMLE, is an antiprotease. Okay, so they can write the answer as deficiency of antiprotease. Ooh, wow. Wrong fucking answer. You know the deal. I'm going to make more content. Be like, Mr. Subscribe my channel. Appreciate your time. That's it.